your liability if they don't do a good job. So it's very important for you to make sure you oversee what their protocols are. If they're doing this important notification responsibility for you on your behalf, if they have the breach, you want to make sure they're doing it according to your standards, because it's ultimately always your liability at the end of the day. We talked about this, just documents for you for reference purposes. Before high tech, the floor and ceiling was 100 up to 25,000. Now it's 50,000 up to 1.5 million. That sliding scale depends on how prepared or not the organization was to fend off a breach in the first place. Did they encrypt? Did they do appropriate amounts of training as high tech requires, so that employee error, which is really climbing the charts quickly as a leading cause of data breaches in the healthcare space, just negligence, employee mistakes and errors, leaving information unlocked, leaving it out on their desks, taking it home. These things need to be trained to, so the organization can say they did their best to have all their employees aware that it's everybody's responsibility and to try to prevent, these unauthorized accesses to this information from happening. And there are criminal penalties as well. A couple examples here that you can read when you have this presentation at your leisure in terms of recent breaches that involved much larger fines and numbers of PHI records. But if we move on to the next slide, we'll see that, next slide as well, please. These are still larger risks. These are, if we look down to Phoenix Cardiac Care, for example, a $100,000 fine for a very small physician practice, simply because they didn't have any policies in place to prevent a breach. They said they had a privacy officer, but they really didn't. There was a job description, but nobody in the role. So that didn't look too well to the regional OCR office when they reviewed the data breach that happened there. Hospice, a small hospice in northern Idaho, had a $50,000 settlement when an unencrypted laptop for 441 patients was stolen. It turned out during the Office of Civil Rights review that there was no risk analysis done by the hospice before the breach as to where their areas of exposure were. They didn't have policies and procedures in place to address mobile device security. They didn't think they should be encrypting laptops. All of these things that weren't evaluated beforehand were found to have been really big deficiencies, and that's in large parts of the $50,000 fine that was assessed. So those aren't huge numbers, but certainly they can be very staggering to an organization's bottom line, quite apart from the fact that there can be stated